Hi again. This is Michael Stellifson, Assistant Professor in the Department of Health Education and Behavior at the University of Florida. Thank you so much for participating in our first two surveys. Your feedback has been very useful in helping us determine the most important comparative effectiveness research topics in COPD care coordination. You are now taking the final survey that we will ask you to complete as part of this study. In this video, I'd like to briefly summarize the group results from the last survey, Survey 2, by describing the percentage of participants who either agreed or disagreed that a particular comparative effectiveness research topic was important to study further in COPD. After watching this video, you will be asked to rank each of the research topics from most to least important. Please consider the group summary results from Survey 2 before completing this final survey. The table on this slide displays the percentage of study participants who strongly disagreed, or somewhat disagreed that a particular COPD care coordination research topic was important to study in future comparative effectiveness research. Overall, the percentage of participants who disagreed with a topic's importance was very small, at around 5% or less for all topics that were considered. A little over 5% of participants strongly disagreed that the management of COPD with other chronic health conditions was an important topic to study further. No participants disagreed with the importance of 5 of the topics. These topics were the following: depression and mental health management, measurement of quality of care, comprehensive COPD patient education, cost effectiveness of care coordination, and measuring hospitalization risk. This next table displays the percentage of participants who somewhat agreed, or strongly agreed that a particular COPD care coordination research topic was important to study in future comparative effectiveness research. Over 90% of participants either agreed or strongly agreed that pulmonary rehabilitation as a model of care, quality of care coordination, and comprehensive COPD patient education were all important care coordination topics to study further. The comprehensive patient education topic had the highest percentage of participants who strongly agreed with the topic's importance. Over 75% of panelists strongly agreed that comprehensive COPD patient education was important to study further. Almost 70% of participants strongly agreed that the topic quality of care coordination was important to study further. Quality of care coordination received the second highest percentage of strongly agree responses when compared to other topics. The topic cost effectiveness of care coordination had the third highest percentage of participants who strongly agreed with the topic's importance. Almost 65% of participants strongly agreed that cost effectiveness of care coordination was important to study further. Other topics such as pulmonary rehabilitation as a model for care and case management received relatively strong support as also being important care coordination topics to study further using comparative effectiveness research methods. In Survey 2, we also received comments from patients related to several of the care coordination topics that were rated. Overall, the topic management of COPD with other chronic conditions received the greatest number of comments from patients. Patients discussed difficulties managing COPD as well as breathing problems that they experienced during their treatment. One patient stated, "The study of COPD is not just the study of breathing, but of overall health as well." Patients also discussed treatment at home versus treatment in the hospital or at another healthcare facility. One patient noted, "When I have a breathing problem, I am glad for the home treatment that I was given. Most people can't afford to go to the hospital every time their COPD acts up beyond what they can treat at home." Another patient stated, "A facility between hospital and home with better education and exercise programs may be very helpful." Several patients also mentioned the cost of treatment and care when responding to Survey 2. One patient stated, "I imagine a coordination plan can help in controlling the cost of treatment, since having the knowledge can help in managing COPD, thus reduce the number of visits to the doctor." This concludes the part of the video that describes a summary of results from the last survey that you completed, Survey 2. At the end of this survey, you will be redirected to a secured web page that is not connected to your survey responses. On this page, you will be asked to provide your name, mailing address, and email address if you wish to receive a $45 Walmart gift card for participating in this study. You must provide this information in order to receive a gift card for your participation. If you choose to provide us with this information, you will receive your $45 Walmart gift card in the mail within 3 weeks of completing this final survey. Again, we appreciate your willingness to participate, and we hope that you will consider participating in our future COPD studies that we will be conducting out in the local Gainesville community. Here is the website source for the image used in this presentation. For more information on our research, please visit our website at www.copdflix.com. Thank you very much for your time and effort in helping to improve local COPD research.